Hello, my name is Dr. Heather Lau. I'm the director of the Lysosomal Storage Disorders Program at NYU. I'm also the associate director of the Division of Neurogenetics. Today we'll be talking about COVID-19 pandemic and the impact on Gaucher disease. We'll start off with the overview of the manifestations of COVID-19 infection, and then we'll move into talking about the impact of COVID-19 on Gaucher disease. Then we'll discuss the impact of COVID-19 on access to therapy for Gaucher disease. And then we'll talk about if you are exposed to COVID-19, what to do as a Gaucher patient. And finally, we'll touch upon some ethical considerations of treating COVID-19 and Gaucher disease. The typical symptoms of COVID-19 include fever, dry cough, and fatigue. However, there are other, quote, uncommon symptoms that we're seeing in patients, including productive cough, shortness of breath, muscle aches and pains, sore throat, headache, chills, and we're even seeing some gastrointestinal symptoms such as nausea, vomiting, diarrhea, or loose stools. And occasionally we're seeing even conjunctival injection or red eyes. Some people are noting anosmia, which is the loss of smell or the loss of taste. And then there are other patients that are completely asymptomatic, but they are COVID-19 positive. It is unclear why some patients get severe disease and why others have a mild course. There are a few comorbid conditions that put you at increased risk, including cardiac disease, diabetes, hypertension, and being overweight or obese. However, we don't know all the factors contributing to a more severe course of COVID-19. So this viral infection starts to develop 2 to 14 days after exposure. Transmission, we think, is through droplet via cough or sneeze near a person who is COVID-19 positive. We do see contact transmission. We do see transmission through contact with affected surfaces. So if you touch your hand on a surface that had COVID-19 and then touch your face, you have transmission. There's also reports of fecal oral transmission. The disease can progress over 2 to 3 weeks, and for mild cases can resolve within 1 to 2 weeks, whereas the more severe forms of the disease can last for weeks and may require mechanical ventilation. Severe complications of the disease include development of pneumonia, development of a condition called acute respiratory distress syndrome, cardiac dysfunction is observed with myocarditis and sudden death, as well as kidney dysfunction, including end-stage renal disease requiring dialysis. So let's specifically look at what is acute respiratory distress syndrome. This is a complication of pneumonia or an infection of the lung, in this case from the viral particle called COVID-19. Some patients who have this pneumonia will develop ARDS. Not all patients develop this ARDS. So what is ARDS? The fluid builds up in these tiny elastic air spaces called alveoli, which are in your lungs. And this fluid keeps your lungs from filling with enough air, which means less oxygen reaches your bloodstream. This deprives your organs of the oxygen they need to function, including your heart, your kidneys, and even your brain. The symptoms of ARDS vary in intensity and are exacerbated by underlying medical conditions. It can lead to severe shortness of breath, labored and unusually rapid breathing, low blood pressure, and in certain cases, it can lead to confusion and extreme tiredness in severe cases. Complications of ARDS include development of blood clots, leading to increased risk of stroke. You can develop a collapsed lung because most patients with ARDS require mechanical ventilation and intubation to provide oxygen in high enough levels for the body. And when we require high levels of oxygen and the high pressures, we can cause the lung to collapse. You may develop secondary infections, including bacterial pneumonia or sepsis. And finally, after prolonged mechanical ventilation, you can develop scarring of your lung tissue, leading to fibrosis of your lungs or stiffening. So how does COVID-19 affect patients with Gaucher disease? Well, most patients with Gaucher disease do not have baseline pulmonary dysfunction. In very rare cases, Gaucher can cause an interstitial lung disease. Most Gaucher patients do not have underlying pulmonary disease. However, they might have comorbid conditions such as COPD, emphysema, or asthma. And these are all risk factors for developing severe complications in COVID-19 infection, including ARDS. Cardiac dysfunction is observed in COVID-19 patients. It includes sudden cardiac death, myocarditis or inflammation of the heart, and we can even see prolongation of the QT interval on an EKG. And that might be iatrogenic or caused by one of the medications we're starting to use to try to treat COVID-19. This is called hydroxychloroquine. These are all observed in COVID-19 patients. In our Gaucher patients, some of them do have some underlying cardiac dysfunction, including pulmonary hypertension. And we do see this at a higher rate in patients with Gaucher disease, but more often in our splenectomized patients. But what's really important is that some of our patients are taking a therapy called elaglustat, which has lots of interactions with other medications and can also cause a prolongation of the QT interval. So it's very important that our Gaucher patients who are taking this therapy tell their doctor or treating physician if they are on it and they have COVID-19. Other complications of COVID-19, what we see in the liver and spleen is we see an elevation in the liver function tests or the enzymes. We also see an elevation in ferritin. And these are indicators of a worse outcome of COVID-19. So doctors might use this as an indicator that the patient's going to progress and worsen. It can also affect the synthetic function of the liver, leading to hypercoagulable states or DIC, disseminated intravascular coagulopathy, or risks of bleeding due to lack of clotting factors. So how does this relate to Gaucher disease? Most Gaucher patients have normal liver function, but their livers are enlarged, especially if they're not on therapy. And so the enlargement may or may not cause liver dysfunction, but it might mislead the clinician who's treating you for COVID to think that this is related to COVID-19. Gaucher is a rare disease and not every clinician is familiar with the baseline manifestations of Gaucher. We also often see in my Gaucher patients here in New York City a coexisting fatty liver or even fibrosis and cirrhosis. And this will affect the liver function and could also adversely affect the outcome if you're infected with COVID-19. We do not know absolutely the risk of this because this is a new infection that we are dealing with. But we are concerned that it might raise your risk of complications of COVID-19 if you have associated fatty liver disease or cirrhosis. Interestingly, in Gaucher disease, we oftentimes see ferritin, this iron storage molecule, being elevated. And it comes down with treatment of Gaucher. However, it's not necessarily a marker of COVID-19, and that has to be communicated to the treating physician. Other complications related to COVID-19 that we're discovering from China, Italy, and even our experience in the US is there are neurologic manifestations associated with COVID-19 infection. We are seeing seizures in many of our patients, not necessarily due to direct COVID-19 infection, but related to the complications of being on mechanical ventilation and leading to DIC. So we're seeing electrolyte disturbances, hypoxia, that lowers your seizure threshold, and we can start seeing this in our patients. We are also seeing an increased stroke rate in our patients due to a hypocoagulable state with severe COVID-19. When there's prolonged hypoxia, as we described earlier, leading to lack of oxygen to vital organs, that includes the brain, we can see hypoxic ischemic encephalopathy, as well as an encephalitis. We're also seeing some peripheral nerve damage, as well as autonomic instability. These are just being reported. And it's important that we are on the lookout for this in our patients with COVID-19. So how does this affect our Gaucher patients specifically? Well, as many of us know in the Gaucher community, there's an increased risk of Parkinson's in this community. And Parkinson's disease puts you at a particular vulnerability to any kind of infection because they oftentimes might have an inability to cough or swallow adequately in the end stages of Parkinson's. And there's multiple medications that could lead to cardiac issues. The neuronopathic form of Gaucher, Gaucher types 2 and type 3, these patients do have a risk of seizures, or they might already have seizures, and this is exacerbated in COVID-19. We also might see neurologic decline if they're infected. In Gaucher disease, we do see monoclonal gammopathy of unknown significance, polyclonal gammopathy, multiple myeloma, and other immune dysregulation. We're not certain if this is empirically increases your risk of COVID-19 complications. However, many of our patients who have multiple myeloma are on immunosuppressive therapy and therefore would be at a higher risk. But this remains to be seen and needs to be studied in this population. We do see renal dysfunction in COVID-19. Certain patients can progress from renal failure to requiring dialysis. Typically, Gaucher patients do not have any abnormalities in their kidney function. So let's talk about the impact of COVID-19 on access to therapies. Gaucher disease has 5 FDA-approved therapies, 3 of which are intravenous enzyme replacement therapies, and 2 of which are oral substrate reduction therapies. The enzyme replacement therapies occur as every 2-week infusions typically, either in an office setting or in a home setting. And over the past month here in New York, we've identified some issues related to infusion therapies. Many of our patients are afraid of exposure to COVID-19, and they want to reduce their interaction with the medical community so that they do not get COVID-19. So infusion centers and agencies started to institute ways to reduce the risk to both their staff and to their patients. Patients are screened by phone before their appointment, looking for signs and symptoms suspicious for COVID-19. And they are again asked at the check-in of their appointment at the center or upon arrival of the nurse to their home. If the patient is known to have any type of exposure or is becoming symptomatic with suspicious symptoms, the infusion agency nurse or the center will recommend a 14-day quarantine and to go home and self-monitor. If there's no development of symptoms after exposure, or if the symptoms end up resolving, patients may return to infusion therapy with clearance from their medical provider. This is to reduce infection of other patients in the infusion center and among infusion nurses' patients. But in addition to the exposure of the nurse, we worry about the exposure of the patient. And I would empower our patients and family members to reach out to infusion centers and their home infusion agency to ask the following questions. Are all RNs using PPE, or personal protective equipment, between patients? Typically, the healthcare workers are not routinely tested. And what we know is that COVID-19 can be spread even if you are not symptomatic. Up to 1 to 2 days before you develop symptoms, you can spread this disease. So in New York City, as we saw more and more community spread, it became standard of care to ensure that our nurses infusing our patients are using PPE. And this is important. In addition, the RNs are self-monitoring. So they're taking their temperature and looking for signs and symptoms of COVID-19 and self-quarantining if they develop any of those symptoms. You want to ask if other patients in the infusion center are wearing masks or told to wear masks. You may want to wear a mask yourself when you're being infused. And then it's also important, as this epidemic takes hold in your community, as what happened here in New York City, we have a shortage of healthcare workers. Our hospitals are getting a surge of admissions, and they're asking for help from nurses. So it's important to ask your nursing agency or your infusion center whether the nurses infusing you or your family member are dedicated nurses, or are they helping in COVID units, which is a noble endeavor, but it could put your family member or yourself at risk. So what I've been trying to do with my own population is identify the nursing agencies that are using that have exclusive infusion nurses. And sometimes this is difficult as the epidemic takes hold and there's more and more shortages. But it's important to reduce the exposure of our vulnerable patients. So what if it comes down to a shortage of nurses, or that the patient or family member is too scared to even allow a person into their home or to venture out to an infusion center, and they want to defer their infusion? Ideally, infusions would continue during this pandemic. It's important because Gaucher disease can progress if you're off therapy. This includes development of bone pain. It can affect your platelets and your red blood cell counts. It can produce fatigue. People can tolerate being off therapy to different degrees. Some people can tolerate for being off therapy for weeks to months, and others cannot. So ideally, we would continue during this pandemic, especially if this is projected to last through the summer, as some are saying. However, as the rate of infection rises in your community, and there might be orders to shelter in place, some of the patients will not want to pursue infusions. The decision to defer an infusion is an individualized risk assessment. The patient or the family member should reach out to the Gaucher expert and discuss the individual risk versus benefit of continuing the infusions versus deferring infusions during the height of the epidemic. So how would you do this? You would review your current disease burden by looking back at your labs, recent assessments, and then talking with your physician about the risk of disease progression and the risk of an infusion-associated reaction when you return to therapy, which can occur in some patients when they're off therapy for too long. Then the decision to see how long or how many infusions to defer. Regardless, it's important that you keep in contact with your Gaucher provider during that time, and to periodically reassess how you're doing, and to see whether or not it is important to resume treatment. Assess for the signs of disease progression or the symptoms of disease progression, such as fatigue, or easy bruising, easy bleeding, bloody nose, or bone pain, which would suggest that the disease has progressed. Again, this is an individualized decision that should be made between the patient and their doctor. I do want to talk specifically about the oral substrate reduction inhibitor therapy, Serdelga, or elaglustat, and the use of this medication during the COVID exposure or infection. As I stated before, elaglustat, or Serdelga, has over 200 drug-to-drug interactions, and use with a contraindicated medication can lead to prolongation of the QT interval on the EKG, which is potentially dangerous. We are seeing more and more use of hydroxychloroquine and azithromycin to attempt to treat COVID-19. The data is not definitive whether or not it's effective, but we are seeing off-label use, not only for severe disease, but even earlier in the disease with mild symptoms, or as post-exposure prophylaxis, meaning you were exposed to a patient with COVID-19. This may not be routinely done in your local community, but it's being done here in New York City. And it caused me to pause and to discuss with other Gaucher experts, what do we do? Since we know that hydroxychloroquine and azithromycin are contraindicated medications when using Serdelga. And I just want to highlight that not all the drug checkers, the medication interaction checkers online, have this interaction. And so you might be falsely reassured that you can take the medication. Please call your Gaucher doctor before you start hydroxychloroquine and azithromycin if you're on Serdelga. So this particular conversation should occur at the start of any symptom of COVID-19 in you. So you develop a fever and cough, you call your Gaucher expert and say that you are concerned that you have COVID-19. In discussion with other Gaucher experts around the country, we decided on the recommendations to stop the Serdelga if you develop these signs and symptoms of COVID-19, and to call your doctor, and to remain off Serdelga until they've resolved or recovered. And that is because you might potentially be offered hydroxychloroquine and azithromycin, and we wouldn't want to preclude you from the potential of this therapy. It is an individualized decision whether or not you want to take this therapy, but we don't want it in your system so that you are absolutely contraindicated. And it's also caution should be applied to if your test is negative for COVID-19, but you have suspicious signs and symptoms, such as the typical chest x-ray findings or pneumonia associated with COVID-19. You still may want to err on the side of stopping Serdelga, talking to your physician, and to restart when it is safe, which is decided between you and your Gaucher physician. It's also important to stop Serdelga even if you're not on hydroxychloroquine or azithromycin, because as the disease progresses, it could progress very rapidly over hours, from having just a simple fever, dry cough, and lethargy, to that warning sign of shortness of breath or difficulty breathing. At that point, you want to go to the emergency room. And as we discussed with all patients who start on Serdelga, if you're hospitalized, we don't know all the medications that you might be prescribed in real time. And we do not want an interaction, a negative interaction with Serdelga. So it's prudent to consider stopping Serdelga upon arrival or upon going to the emergency room. Because if you need mechanical ventilation or rapid intubation, there are many medications that are used to sustain the sedation that you require. And those negatively interact with Serdelga, such as fentanyl, and can lead to prolongation of the QT interval, and can definitely cause more harm than good. Again, for your specific concerns, talk to your Gaucher doctor, but know that elaglustat cannot be combined with many medications we use for sedation, which we use for mechanical ventilation. COVID-19 itself, in addition to the medications you're exposed to, can cause cardiac dysfunction, including sudden death and myocarditis. And that in and of itself is concerning. So how do you prevent exposure to COVID-19? As the disease begins to spread within your community, as it has here in New York City, we start to want to limit contact with others to varying degrees. We don't congregate in large groups. The limit of the size of group is dependent on your local the limit on congregation size. These limits are dictated by your local guidelines. Here in New York, we are under a shelter-in-place order, and only essential workers should be going to work. No social activities should occur with anyone outside your household, and you only venture out for groceries, medical appointments, and exercise. However, if your community does not yet have a lockdown or a shelter-in-place order, and you have Gaucher disease and or any other condition that puts you at a higher risk of severe complications of COVID-19, you might want to start to limit your interactions with others. You might want to consider homeschooling. And you might want to discuss that with your Gaucher provider and the teacher. If you're in college and you have Gaucher disease and you have other comorbid conditions, you might want to ask about remote learning. If you're working in either an essential or non-essential capacity, you want to talk to your doctor about your risk of exposure and see if there are alternative ways to conduct your job. Can you work from home? Your employer might require a letter outlining your increased risk of COVID complications, and you should ask your Gaucher expert to write that letter for you. If you're deemed an essential worker and you're supposed to go to work, again, you might want to have a conversation with your doctor to discuss your risk, your personal risk, and whether or not you should be included in, and whether or not you should continue working due to the increased risk of COVID-19 complications. However, you cannot stay in your house all the time, and you do need to venture out in the community. So how do you protect yourself? Wear a mask. That's more about protecting others if you're pre-symptomatic, to prevent pre-symptomatic spread. But it can, to some degree, protect yourself from maybe touching your face. So you want to avoid touching your face when you're out in the community because of the transmission from your hands into your eyes, nose, or mouth. You want to maintain at least 6 feet from others as you're walking down the street or in your grocery store. You might want to avoid going at times that are very busy. And obviously use hand sanitizer as you're going about in the community. And when you arrive home, either use hand sanitizer or good old plain old soap and water for 20 seconds can kill the COVID-19 virus. Some people ask me about gloves. Gloves only work if you don't touch your face. So if you're walking about in community and you're using gloves, and then you're touching your cell phone or touching something else, you take those gloves off and then you touch your cell phone, you've now exposed yourself. So what happens if you are exposed to COVID? Either you're exposed or you might start to have some subtle symptoms of fever, cough, runny nose. You might think it's allergies, you might think it's just a common cold. Regardless, you should reach out to your primary physician and or your Gaucher physician. You want to discuss the potential of the exposure or the symptoms, and then review your current meds to make sure that they're appropriate and up to date in the list that your doctors have, and review the other comorbidities, whether or not you have other risk factors for severe disease. Your physician will likely tell you to self-isolate immediately. You might want to even self-isolate within the home by designating your own room, and if possible, your own bathroom, and ensuring that you're using hand hygiene to prevent exposure to others, especially if there's other vulnerable people in your home. You should also just start to self-monitor. What does that mean? That means taking your temperature twice daily, looking for a fever defined as 100.4 degrees Fahrenheit or above. You might want to note the development of other symptoms, especially if there's the development of difficulties breathing or shortness of breath. You want to discuss with your healthcare provider when to go to the emergency room. You want to do this at the initial phone call because things can change rapidly with this disease and you want to be prepared. You may even want to go earlier, or you might be asked to go earlier because of your Gaucher disease or your comorbid conditions. So I would suggest if you develop symptoms of COVID and they start to progress, that you might want to create a to-go bag. In that to-go bag, an updated list of medications, list of your medical conditions, your advance directives and healthcare proxy, list of primary contacts, your cell phone and chargers, and possibly even a letter from your doctor describing Gaucher disease. Many of the clinicians, as you know, don't know what Gaucher disease is. And so that would be helpful for the ER physician or the ICU attending or the intensivist to understand what is Gaucher disease and how is it affecting you personally, and if your disease is maintained on therapy or not. And why is this? Most hospitals are starting to limit visitors. Here in New York City, we actually don't allow any visitors for adult patients. We limit visitors for pediatric patients to 1 parent. So that is important to have this information. It's a very stressful time. You might be very sick. You might have difficulty talking because of shortness of breath. And that's why it would be useful to have this letter and the list of your medications, especially if you're on Serdelga. So let's go back and discuss when do you seek medical attention. So if you develop these warning signs, you should call 911 or go to your nearest emergency room. And the number 1 sign is trouble breathing. So shortness of breath, described as inability to carry conversation, or just simply being out of breath or winded after you walk across the room. Increased rate of breathing, increased heart rate are all signs of difficulty breathing. And this should prompt you to go to the emergency room. If you have pain in the chest or chest pressure, you have any kind of gray or bluish discoloring around your lips or face to suggest difficulty oxygenating yourself, or new confusion or just severe fatigue and lethargy, or your family member cannot rouse, they should be calling 911. Obviously, this list is not inclusive, and you should go to the emergency room if you are feeling severely unwell. So finally, let's just briefly talk about ethical considerations for patients with Gaucher disease who develop severe COVID-19. This pandemic has led to the realization that we had shortages in our resources. We had shortages in personal protective equipment, such as masks, gloves, and gowns. And we also have shortages in mechanical ventilators and dialysis machines. We're expanding hospital capacity by building new bed. We're expanding hospital capacity by converting floors into ICUs that are not normally functioning that way, including operating rooms and other ambulatory floors. We have overflow tents. We have other areas becoming hospitals because we are having an influx and surge of admissions. And there is a very real shortage of mechanical ventilators. And it's very concerning for all of us in healthcare because we want to provide the best care to every single patient that walks in the door. And it's important that we discuss whether or not the diagnosis of Gaucher impacts your eligibility for mechanical ventilation. In my opinion, it does not. We have to advocate that a simple genetic or biochemical diagnosis should not automatically exclude a patient from mechanical ventilation. And I think most of my colleagues agree. We're not going to discriminate based on genetic or biochemical diagnosis. Many of our Gaucher patients are well maintained on therapy, or they're even asymptomatic. And so we should assess each individual and their individual disease burden, stratify it by age, comorbidities, and organ function, as we do for anyone who walks into the emergency room. Just having this diagnosis of a rare disease should not preclude you from mechanical ventilation. But because you have a rare disease, we need to educate those doctors immediately and in real time about Gaucher disease and what is affected in Gaucher disease and what is not, and your overall health and well-being. That is why if you become ill with COVID-19-like symptoms and you're concerned about progression or hospitalization, reach out to your Gaucher expert immediately. Consider asking your physician for a letter stating what your condition is and the severity of the disease, your treatment history and response, and provide the ER or ICU team with a contact number for your Gaucher provider. I have done this for my patients when asked if they become symptomatic and start to progress with their COVID-19 symptoms. It's important that we communicate to the treating team about your disease state so that we don't erroneously stratify your risk and that we ensure that everyone is assessed appropriately for the appropriate level of care. Thank you.